Hello, I'm one of the respiratory therapists from Midwest Medical, and today we will be showing you the LTV 950 ventilator. Okay, first we're going to look at the right side of the ventilator. On the top of the ventilator you have a filter. You need to take care when you're taking the filter cover off to change or clean your filter that you're not taking anything and poking inside the filter. There's a fan behind the filter, and if you poke into that fan, you're going to cause problems with your ventilator. So you can either take your fingers, or what sometimes people will do is attach a twist tie to the filter cover so it makes it easier to pull it out. If you do decide to go with this method of using a twist tie, make sure you remove the filter cover before installing the twist tie so that you're not having the same issue of poking into the ventilator. So what you'll want to do is pull the filter cover off. Then there's a filter in here that needs to come out weekly or whenever it looks dusty or dirty. It needs to be rinsed out, air dried, and then popped back in. And then you would just install your filter cover back over the top of the filter. I'm going to skip down to the bottom of the ventilator because you have another filter down here that does not have a cover, but this is a foam filter that also needs to come out about once a week or whenever it looks dusty or dirty, and again needs to be rinsed out with water, squeezed out and air dried before you replace it. Now often what you will do is have more than one filter, so you can take one out for cleaning and put a clean dry one in so you're not running the machine without your filters. And that's something you do not want to do, is run the ventilators without the filters, because you don't want the ventilators to get any dust or particles inside. Alright, up at the top here below your first filter, this is where your power cord will plug into. Now I have the power cord right here. There's a box with a cord that's going to go to the ventilator, and then on the other side is another cord that's going to go into your wall outlet. You should plug the unit directly into a wall outlet. That is the best way to do that, to plug it directly into the wall. Alright, if you take a look, you can see the connection. There's a little push button on the power cord side that will just pop right into the ventilator. Now when disconnecting this, you want to be careful not to pull. If you do, you can break your little connector here, and then the connector won't stay firmly connected. So you need to be very careful when disconnecting. Now your other option that you have to plug in here would be a battery cable. And the battery cable actually has the same connector as your power cable. So what you would do is go ahead and plug that in as well. It's only going to fit in one way. And then the other end would plug into your battery. This comes with a little pronged end that you would line up with the holes on the front of the battery, and it would just plug in like so. Alright, then below where your power cord is, there's an outlet where you would add your oxygen if you needed to. You would just take this green cover off and your oxygen tubing would connect right at this port. If you're not using oxygen, you can just go ahead and leave that connected. Okay, so now we are going to look at the other side of the ventilator. On this side of the ventilator, up near the top, you have your alarm speaker. So you want to take care that you are not blocking this with anything, because you always want to be able to hear your alarms clearly. Below that we have 3 ports, small ports, and then 1 large port, and this is where your tubing is going to connect to. So on the bottom, I'm going to start there with the large port. This is where the air is going to come out that's going to ventilate your patient. And first we're going to put a bacteria filter on the ventilator. If you take a look, you can see that there's 2 openings. One is smaller, one is larger, and the larger end will fit right onto the ventilator. Then you are going to attach your large bore tubing coming off the filter. Above that are your sensing lines, and there are 3 of them. And if you take a look, the ends all are different, so you can't mix these up. You can't connect them to the wrong spot. The first one is just a regular push-on piece of tubing. You just push it on nice and tight. And then you have a yellow connector and a white connector. And these actually twist to go on. Now, there's a little trick to putting these on. If you take and hold them between your fingers and you twist them towards you, forward, and you put them on, they'll spin back automatically almost. And then you just need to tighten them up. Same with the white one. You just twist it towards you and it'll spin back. That way they'll just go on nice and straight and you're able to tighten them. So you always want to make sure that they're on tightly. If they're not, you're going to get some alarms on the ventilator, and we'll talk about those later. Now I have this system set up without using a humidifier. So this would be if your client was using an HME, or if they were using this portable where they wouldn't be able to plug in a humidifier. But often you will have your client also connected to a humidifier. So if you were going to put this in line with a humidifier, you would disconnect your large bore tubing. You would have a hose or tubing, another large bore tubing that would connect to your filter, go to your humidifier, and then your ventilator circuit tubing would actually come off the other side of your humidifier. And your humidifier may be sitting next to the ventilator, or it could be installed on an IV pole, either way, but it will be somewhere right close to the ventilator so your patient can get humidity. Okay, now we're going to look at the front of the ventilator. I'm going to go through what everything is that you're seeing on the front of the ventilator. I'm going to start at the very top where it says airway pressure. Now when your patient is on the ventilator and connected, what you're going to see is some green lights come on each time that the patient is delivered a breath. And this will show you how much pressure is being generated with each breath. This is a display that quite often will be different with each breath. It isn't always exactly the same, so you can expect to see that. Down below that is a screen where you'll see some different readings show up, and we'll talk about those in a little bit. Over here you can see that there's 4 little boxes, and those all mostly have to do with your battery. The top one is your patient effort light. And what that is doing, that will light up each time the patient initiates a breath on their own. That will light up. Below that is your external power light, which is on right now because I have my ventilator plugged into a wall outlet, and it's telling me that it's getting external pressure. Now if I have the ventilator connected to an external battery, I am also going to get the external power light. If it's running on the internal battery, then this light will not be illuminated. Below that is a charge status, and what that is telling me is that my battery is being charged. And it will either be green, amber, or orange like it is now, or red. And when it's fully charged, it'll go to green. When it's charging, it'll be amber. And when it needs to be charged, it will be red. Below that is my battery level indicator, and that would be indicating the internal battery. And again, that also works on a green, amber, or red. So when it's green, my battery is fully charged. When it's amber, it's partially charged. And when it's red, it needs to be charged. Now, the ventilator itself has an internal battery, and it also has the capability to be plugged into an external battery. You always want to use an external battery when you are using the ventilator not plugged into your wall outlet. Your internal battery is for emergency use only. Your internal battery will last you approximately 45 minutes, so it's never something you want to depend on for transport. If you're just moving a patient, say, from room to room or from the bed to the chair, and you unplug it and you're using it on internal battery for just that short amount of time, that's fine. But you don't want to take your patient anywhere without some sort of external battery source. Okay, I'm going to come over to this green box, and this is where all your settings and your controls are. If you look right down on the bottom corner, this is where your on-off power switch is, so this is how you will turn the ventilator off and on. Next to that, you have your mode settings. And the first one you come to is either a volume or pressure setting. So you can set this ventilator to either deliver a preset volume or a preset pressure that's ordered by the physician. Your other modes would be either assist control, SIMV, or CPAP. So the majority of the time, what you are going to see is most patients are going to be in assist control, but that's not to say that you wouldn't sometimes see some other modes. Assist control, how that works is your patient would be, your doctor would order settings for a breath rate and tidal volume, and your patient would be guaranteed that rate at that tidal volume. But your patient would be able to initiate breaths above whatever the preset rate is. SIMV works close to that, but it's a little bit different. You still would have a tidal volume and a breath rate prescribed, but your patient actually would be able to initiate and breathe on their own. They would be able to initiate their own patient breaths, which would be different than assist control, where if they're initiating a breath, they'd be getting a ventilator-delivered breath. The ventilator also has the capability to be used in the CPAP mode. Now, next to that, there's a manual breath button, where if you push that button, you would be able to give your client manual breath. And then next to that is your control lock, and that's a setting where you're able to lock the settings so no one can come in and change them. And you would have to push your control lock button in order to do any setting changes. Above that is where all your settings are. Now, most settings are prescribed by a physician, so you never want to change any settings without having a doctor's order. The first setting that we come to is your breath rate, and that would be how many breaths per minute your patient is going to be delivered from the ventilator. The next setting would be your tidal volume, and that would be the amount that's being delivered with each breath. Next to that, you have a pressure control, and that would be if you were using this in a pressure mode, instead of putting in a tidal volume, we'd be putting in a pressure, and the ventilator would deliver a certain amount of pressure with each breath as opposed to a tidal volume. Next to that, you have your inspiratory time, and that would be how much time it takes for that breath to go into the patient. And then the next setting is a pressure support setting, which again would only be functional in your pressure mode. The last one down here is a sensitivity setting, and that typically is not ordered by a physician. That can vary from patient to patient, and it just determines pretty much how easy or how difficult it is for a patient to initiate a breath, and that's sometimes something that we have to play around with a little bit to get just right for each patient. Now, if we go over to the red box, this is where your alarm settings are. Now, there's other alarms that are set on this ventilator, but those are set in a different menu, and that's something that we would come in and set for you. You won't see those alarms, but these three alarms are what we'll set on the front of the ventilator, and you'll be able to see what they're set at. The first one is a high pressure alarm. The next one is a low pressure alarm, and then we have a low minute volume alarm, and I'm going to explain those to you in a moment. If we look over here, we can see where there's a vent in-op light, and it's telling us that the ventilator is shut off right now. And you will see that light whenever you come in and your ventilator is off, or when you shut the ventilator off, that vent in-op light will come on. You also have a silence reset button. So you would be able to silence an alarm, and anytime you get an alarm, that would be what you would press to reset it. So your high pressure alarm, that would be set according to your patient's pressure, and anytime your patient generated a pressure that was above this alarm setting, you would get an alarm. Now, some things that can cause that would be some sort of obstruction in your tubing. It could be water in your tubing. It could be that your patient needs to be suctioned. Sometimes if your patient is coughing or talking, you can get a high pressure alarm. That's something to do with your patient or your circuit. It's nothing to do with anything wrong with the ventilator. It's just alerting you that for some reason your patient's pressure is going higher. And if the patient's coughing or needs to be suctioned, that's something you can easily take care of. Now, the low pressure alarm, that would be if the patient or if the ventilator senses a pressure lower than what you'd have that alarm set at. And that could be any leak or disconnect. So if your patient comes off the ventilator, pops off the ventilator, or any of your lines on your tubing circuit come loose, or anything that you have in line that would have a leak or a disconnect or even a hole in your circuit. So if you have a low pressure alarm, again, that's not a problem with the ventilator, it's a problem with your circuit or your patient. And that could also be a problem actually at your patient, depending on what kind of trach tube they have in, depending on how much air you have or water you have in the cuff. If you don't have enough, that can also cause a low pressure alarm. Your low minute volume alarm also will go off if you have any sort of disconnect or leak in the circuit. And a lot of times patients who are speaking and you are taking the air out of their cuff, a lot of times you can get a low minute volume alarm, and sometimes that will need to be adjusted. So that is what everything is on the front of your ventilator. Okay, so now I'm going to turn the ventilator on so you can see what that looks like. So down in the corner of the green control box is your on standby switch. I'm going to push that one time. The ventilator is going to go through a quick self-check where everything's going to light up and it's going to give you a quick alarm. So this is what it will look like when it's connected to your patient. For demonstration purposes, we don't have a real patient, we have a test lung that we're using. And that's what this is. So you can see when you're looking at this now that my airway pressure graph is lighting up with each breath that my patient is taking. So you'll see that, like I said before, that can vary sometimes. Also, you'll notice that the screen is scrolling through some different readings that it's picking up from the patient, some different data that's coming from your patient. And that'll scroll through and it'll keep showing you that. So if there's things that you need to be writing down on your vent check, you can go through and you can write those down as you go. Now if you want to stop it on one particular reading, if you just come up, there's a little button right here that says select. If I push that, it'll just stay, right now it's on the frequency or breath rate, and it's staying on that setting. So if I needed to write that down or check something, I could. If I keep pushing the select button, it'll go through each one and tell me some different readings. Now I'm going to stop it right now on the PEEP setting because I'm going to show you how to set your PEEP on this particular ventilator. So PEEP is positive end expiratory pressure, and what that does is when your patient's exhaling, you can set this at a pressure that will keep a slight amount of pressure in the lungs and will keep those airways in the lungs open a little bit down at the bottom of the lungs. So it just helps the patients, it helps prevent pneumonias and that sort of thing. So right now it's telling me that my PEEP is set at 4. This is the PEEP valve and it comes attached to the circuit. So there's no PEEP setting in the LTV 950 ventilator. The PEEP needs to be set on the circuit. And it's going to be very difficult to see, but there are some numbers on your PEEP valve that you can twist this to set at, but you always should be reading what it says on the ventilator to get a more accurate setting. So what I'm going to do to set this is there's a little yellow disc on the top, and you need to push down on that to twist your PEEP valve to set it where it needs to go. Now what I'm going to do is I'm going to push down on this and I'm going to twist. And as I'm twisting this valve clockwise, my PEEP is going to go up So I want to set it, and I want to wait a couple breaths because it can take a couple breaths to kind of maintain where it needs to be. So right now I have it set at 5. So if I want to go ahead and adjust that lower, what I would do is go ahead and twist it counterclockwise to set it. So typically 5 is a pretty typical setting of PEEP, but that's not to say that you might not have a different order for a different setting. One thing that's really important is that every client should have a test lung with their ventilator. It may look a little bit different than this, but it will be something that you can put on the ventilator to do any testing that you need to do. When you're setting your PEEP for the circuit, you want to make sure that you have it on the test lung. Because when you put this on your patient, your data readings will come back. They may come back differently just because of different things that are going on with your patient's airway, depending if you have the cuff inflated or deflated. So when setting your PEEP, make sure that you use the test lung, and then when you put it on your patient, as I said, your readings may be a little bit different, but you'll know that you have it set at the correct PEEP as what's ordered by the physician. Now, if I want to get my screen back through, it's just scrolling through those readings, I can come over to the select button and I'll push it quickly twice in a row. So the next thing that I'm going to show you is how to change your settings and your alarm settings. Now, you never want to change any settings without having a doctor's order to do that. But when you're doing your vent check, if you go through and you notice the setting is not at the prescribed setting, you are going to need to know how to change it back to the prescribed settings. So the first thing I'm going to look at is your modes down here at the bottom. Right now I have it in volume and assist control. Now if I go ahead and change this to a different mode, you're going to notice some differences in the settings. So I'm going to go down, and there's the select button right below where it says volume and pressure. And right now you can see that the green light is lit up under volume. If I push that, the pressure light's going to be flashing, and if I push that again, it's going to change it. So now it's in a pressure mode. You'll notice that you no longer have a tidal volume showing because you don't put in a prescribed tidal volume in a pressure setting. You would put either pressure control or pressure support. Now, if you came in and your patient was supposed to be in assist control and it was switched to pressure, your patient would not be getting what they need to get from the ventilator. So you would need to know how to come back and change it. So what I would do is I would come over, I'd notice it's in pressure instead of volume, I'd push the select button, I see my volume light flashing, and I push it again. And then that's going to get me back to where I need to go. Now right now I'm getting a low minute volume alarm, so what I'm going to do is I'm going to push the reset button. I'm going to figure out I'm going to check on my circuit and make sure everything's connected correctly. Then I'm going to reset it. I found my problem, everything's working fine. Now if you come and some of your settings are set incorrectly, like if you come in and you know that your patient is ordered to be at a breath rate of 12, but you come in and you see that it's set at a different setting, what you would want to do is come and push this button underneath the breath rate setting. You'll notice everything goes blank and only your breath rate is showing. Now if you don't do this very quickly, it's just going to pop back into your set settings. So you need to be a little bit quick about this. So what I would do, push the button, and then I come over to the set value knob and I would set it to the correct setting. I push that button again and it would lock it in. Now I'm just going to say again, you don't want to be changing any settings without a doctor's order to do that. And anytime there's a change in settings, we would need to also be alerted to that, and we would come out and change the settings for you. Again, this is just in case something gets set wrong or somebody accidentally comes in and pushes a button and sets it where it's not supposed to be. That's just a way of you getting back and knowing how to change it back to where it needs to go. Now down in this corner there's a control lock. If I push that button, you see how the green light comes on under control lock? I can't change any settings when it's locked. And if I try to do that, it's going to tell me it's locked. I'm also not going to be able to shut the ventilator off if it's locked. So if I want to change any settings or turn the ventilator off, I'm going to need to come over and push that control lock to make the green light go out. Now over here, we have your alarm settings. We have, and we talked about this earlier, your high pressure, your low pressure, and your low minute volume. So a high pressure alarm, if you got a high pressure alarm, your pressure would have to go above what is set here. Now right now it's set at 100, which is something you're probably not really going to see. So I'm going to turn it down to something that would be a little more reasonable, depending on what your patient's pressures are. I'm going to make a high pressure alarm. So this is giving me a high PEEP alarm, which is one of your internal alarms that I was talking about earlier that doesn't show. And I'm also getting a high pressure alarm. So what I would do is I'd want to come and look at my patient, make sure they're okay, and then I'm going to try and determine what needs to be done. Maybe they coughed, and that was what caused that high pressure alarm. Maybe it's continuously high pressuring because your patient needs to be suctioned. You would need to solve the problem, and then you can come over and hit the reset button, and everything will go back to normal. Now, if you hit the reset button and you keep getting an alarm, or you keep getting an alarm flashing visually in the screen, you haven't solved your problem, and you need to continue to figure out what the problem is. Now, a low pressure alarm, I'm going to make one of those. And this is a pretty easy fix in this case, because what I have done is my patients come off. So I'm going to reconnect them. It's going to stop alarming, but it's going to keep flashing at me to tell me which alarm was going off. So if I didn't happen to be in the room, or if I was turned away when an alarm occurred, I can see what alarm occurred, and then I can just hit the reset. Now, say you're going to suction your patient, you're going to disconnect your patient. That's going to cause the ventilator to alarm. You can go ahead and hit the silence, and that will silence the alarm for a minute, and that will give you time to do what you need to do. And then when you reconnect your patient, you can go ahead and reset the alarm again. If you don't solve your problem, or you're not done doing what you need to do within a minute, the ventilator is going to keep alarming. So if you just keep pushing the silence alarm, that's not going to solve your problem. It's going to quiet the alarm, but your patient's still going to have some sort of problem. Now, when it's time to go ahead and turn the ventilator off, what you need to do is come over to the on standby button. You're going to hold it till the ventilator shuts off. It's going to alarm at you, vent up. You're going to hit the reset button in order to silence that alarm, and that's so you can't accidentally shut the ventilator off. I hope that has been helpful, and if you have any other questions, please give us a call here at Midwest Medical at 763-780-0100 and ask for a respiratory therapist. Thank you.